Welcome to Warrior Stories. My name is Susannah Clarke Taylor. Today is December 14th, 2022, and my guest today is Brandi Hitzelberger. Hi, Brandi.
Hi,
How are you doing?
I'm good. How are you?
Good. So I always like to say how I know my guests. And Brandi, you and I are actually fairly new acquaintances. We were connected because you are on the board of advisors for the National Family Association for Deafblind, and I'm currently volunteering as a parent leader for the same organization. And we both participated in an advocacy training that they recently put on. And so that's how we got to know one another. Brandi, I'm actually hoping that you might explain a little bit about your experience with NFADB and kind of how you got connected with them and what you do for them.
Okay. Donna Carpenter. She is our Kentucky Deafblind Project leader, I guess. She told me about NFADB and gave me the information. And she has several friends and helps out with their deafblind experience. She's like, you need to check it out. It's a great resource. So I did. And I participated in the deafblind experience as a panelist a couple of years ago and just really enjoyed meeting people and having that connection. From there, I knew my son was getting older and I wanted to join their adult life committee to kind of be able to connect with some people that had already gone through what I was about to go through. And then I also joined their advocacy committee because that's a passion of mine. They had somebody roll off their board and needed to fill a spot. So they contacted me and asked me if I would be on the board, and I did. And then as time went on, they asked me if I would fill the treasurer spot. So reluctantly, I did. They might come to regret that because
Right.
that's a scary spot, but I'm muddling through that. It's been a great place for me to connect with other families and other people that are sharing in our journey of deafblind children, preemies with challenges. And again, like I said, I look forward to working on adult life, learning the next phase, a life for Alex. So that's kind of why I'm there.
Awesome. We'll talk a little bit about that later. Before I ask you some of the questions that I'm hoping that we can talk about today, I wanted to set some intentions and explain a couple of things about advocacy work. Before I got into formal advocacy, I thought advocacy was just the legislative part, that it was just policy change. And for a lot of years, that just seemed so intimidating to me. I thought that I could never do that, And it took a lot of years of me working with my daughter and talking to doctors and teachers and speaking up for her in IEP meetings before I realized that I was advocating all along. I just didn't do it that way. And it was only then that I kind of started gaining the confidence that I needed to get into what I considered at the time official advocacy, where you actually try to change policy or where you actually try to get pieces of legislation pushed through either, state or federal governments or even say school boards or whatever. But the more I've done advocacy work, the more I've realized that, the policy part obviously is so important. And that is the goal, right? That's the goal for all of us, is to get legislation passed that helps change things for people in real life. But there are so many things that go into advocacy that lead up to the legislative part that I think oftentimes we don't realize are important, or that we don't realize that we're already doing. Another important pillar of advocacy work, I believe, is just the grassroots education. It's just people having conversations and talking about the issues and educating people maybe that are outside of your specific community that might not know about the challenges that you're facing, and forming allyships with other communities. And that's really important. So the grassroots education is so, so important. But I think there's another really important kind of advocacy, and that is simply talking about how it feels to have certain experiences in order to garner empathy between people that are different from one another. And I think as we focus on building empathy between communities that are different from one another, that literally is how our world is going to heal. That is how we will learn to see things through other people's perspectives. And in order to do that, sometimes we need to be willing to talk about things that are really difficult that we've been through. Sometimes we need to, talk about some of our most painful experiences, right? So that other people can understand what it is like on the ground floor being who we are, and having the challenges that we have. And so that is kind of what we are going to be doing today, is talking about some of the more difficult parts of being a parent of a child with disabilities. And so before we jump in, I wanted to read a couple of excerpts from an article that can be found in The Mighty. And I'm not sure if you're familiar with The Mighty. It's a kind of an online magazine that centers around themes of health and disability and community. It's by Dr. Liz Matthews, and she says the following. As a psychologist, I am in the business of receiving phone calls from parents worried about their kids with disabilities. During that initial phone call, parents give me a quick rundown of their child's symptoms, the struggles the family at large is facing, and the specific goals they would like to work toward. During that initial phone call, I'm often left thinking, how are you, as the parent, doing? Parents are often surprised when I ask that question during the intake. Several parents have responded with silence, a confused fine, or no one has ever asked me how I'm doing. As a parent of a child with disabilities, the process of gaining a diagnosis and then figuring out life and supports and medical conditions can be overwhelming and often traumatizing. In my experience, many parents of children with disabilities and other medical needs are experiencing symptoms of post-traumatic stress disorder. PTSD is an anxiety-based disorder that occurs when a person has experienced trauma, witnessed trauma, or has been exposed to the details of a traumatic event experienced by another person or by repeated exposure to trauma. For parents of children with disabilities, they may be re-experiencing traumatic events, sometimes through vivid recalls of memories, maybe not every day, but several times per week. That re-experiencing can be sudden and without an obvious trigger. It can be due to an odor, a word, or a color with which you have developed an association. The re-experiencing comes with intense emotions such as guilt, fear, or even anger. And because the re-experiencing can be so overwhelming, you may find that as a parent, you try to avoid certain places, people, clothes, odors, so that you just don't go there. You may also find yourself feeling hypervigilant or functioning at a high level of anxiety and arousal, which can result in difficulty sleeping, poor focus, and being easily startled. You may also feel irritable and worry about your safety and the safety of your children. And then it just goes on to talk about how it impacts families and your relationships and your marriage and your work and everything else. And so I'm actually really glad that we're going to be talking about this today, because I don't think this is talked about enough, even amongst parents of children with disabilities. So often we're talking about, like, which doctor did you go to for this, or what service do you recommend, or what stipulation in your IEP do you think might apply to my child too, or we're talking about all of those things, but I think sometimes we don't talk enough about how it feels.
Right. As you're reading that, I'm actually tearing up, because many of the things that you say, I feel like I experience, still.
Mm-hmm.
And it brings forward so many emotions, right? So.
Right. So I'm hoping that you'll tell us about your son, Alex, Brandi, and if possible, as you tell us about him, if you feel comfortable, I would love if you would share with us some of the experiences that you have had that you have felt were the most traumatizing for you and your family. And of course, only share what you feel comfortable sharing.
Right. Okay. Well, first, I'd like to say that we did have a previous birth where we lost our first child at 24 weeks, and he lived a couple of days. And, we had to make the decision to take him off the ventilator, which, like you said, I think creates a lot of guilt and still a lot of trauma for me, because we made that decision.
Right.
And I think that when I think back now, even going back into that same NIC unit with Alex was a lot of anxiety. It was some of the same spaces, the same nurses, the same sounds, but Alex, he's a twin. So we had twins, and we knew, because I had incompetent cervix, we knew it was going to be a battle to make it. Our goal was 28 weeks. I actually started opening at 12 weeks. So I was on bed rest at 12 weeks on. And so I had the kids at 25 weeks. They were in the NICU unit. And I think just, you talk about if you've ever been in the NICU unit, the sounds, the beeping, the nurses, the hand washing, all of the terrifying noises that, they tell you you can't touch their skin because it will rip. They don't open their eyes to a certain spot. Their legs aren't developed. And Alex was very, very sick. He had brain bleed. He had liver abscess. He had a bowel obstruction. He had retina prematurity. He had meningitis while he was in the NICU unit. He struggled to eat and breathe on his own, so he had a hard time coming off the vent. At one point, like at the end of the month, they usually like to try to get the babies out of the NICU unit and get them home for their numbers. And I remember one of the nurse practitioners really trying to get Alex home, and she wanted me to learn how to put a feeding tube into Alex's nose. And I could not do it. It was traumatizing for me because they're like, if you place it wrong, it can go into his lungs and all this stuff. So I kind of was just like, I can't do this. He's going to have to stay longer. And she's like, well, we can call social services and we can have somebody else take them that will do it. And, I was just, I'm here every day. I'm with the kids. And I just was dumbfounded.
Yes.
The first time I was able to hold him, he coated and turned blue. And that was, the way it was for just about any time, because anytime you tried to move him, he couldn't, he couldn't breathe. That's kind of why he has this flat spot on his head now, is because they were unable to turn him like they're supposed to. We knew that he was going to have vision loss because of the ROP surgery. Both the kids had it, and we knew they would both have loss of vision. They did the hearing test, and they said he will be deaf because he failed the hearing test. Now, we were lucky that the hearing did get better, and now it's just a mild loss. But, when we were in there, it was like, okay, he's going to be completely deaf and have vision loss, and plus all the developmental complications. The multiple times they told us he's not going to make it. It's the 12 hours. We'll have to see. They said we've had one other baby with this liver abscess issue and they didn't make it. It's just, it was just.
You're talking about the fact that you're constantly being told that he might not make it, right? And they're encouraging you to take him home, but telling you need to learn how to put his feeding tube in. You need to learn how to do, probably a list of things. You're not a trained medical professional, I assume.
Right. Yeah. No.
So these are all things that you have to learn in order to take care of your baby at home. And his life depends upon you being able to do those things, right? And as a mother, especially a mother who has already lost a child, the burden of that being placed upon your shoulders, knowing that you have to learn how to do everything perfectly and care for your child at home. And when you say to them, I don't think I can do that. I don't think I can take that burden on. I don't want to be responsible for keeping my child alive. I am not a trained medical professional. Rather than allowing you to keep your child in the hospital longer, what they do is suggest foster care. Brandi, I cannot even imagine how that felt.
Well, and I also had another child that was in there fighting for her life as well, that I had to, care for and love and make sure, she was also getting cared for and could come home as well. So it was a very overwhelming time.
Wow. So tell us what happened next. How long was he in the hospital?
He was in the hospital for 4.5 months. His big issue is that when he would eat, he would not be able to breathe. And so he would go through this thing where he would code. They'd have to put him back on the ventilator. And so they couldn't figure out what was going on. So they suggested this surgery, which would probably put him on a trach. And there was a doctor at the University of Kentucky that came to us and said, "You do not need to do this surgery. He's probably going to have to end up with a trach if you do it. And we only do this surgery about once, maybe twice a year, especially on NICU unit babies. You need to go to Cincinnati. And they do it all the time. It was invented there. You need to go get a second opinion." Of course, we still had Abby, and she was home at this point. So we truck up to Cincinnati, and they look at Alex. He was there for a couple weeks, and they said it's not a breathing issue. It's a feeding issue. He needs to have less food, but higher calories because it's backing up into his lungs and he's not able to breathe. So they did that, and he came off a feeding tube, started taking a bottle, and came off the vent and started breathing on his own, all within a couple of weeks at Cincinnati.
Oh my
It's a
God.
miracle. Yeah. So he came back to UK, stayed a few days, and then came home.
Wow.
So, yeah.
And how has his development been? I'd love for you to explain what his disabilities are. He's deaf-blind. I'm assuming he's not completely deaf or completely blind, which for those that don't understand, a child that is categorized as deaf-blind, they don't have to be completely deaf and completely blind.
Right.
They just have to have significant impairment in both of those areas. And in one of my other interviews, one of the other moms, Christina, explained that it's not deaf plus blind, it's deaf times blind, and that the challenges faced by a child that has that multi-sensory impairment is exponential compared to a child who may be just deaf or just blind. Right. So anyway, I would love for you to explain what Alex's challenges have been as he has gone through, his pre-K years into school and beyond.
We were fortunate that we started therapy pretty much right away. Not the first year, because we were told the kids had to stay in the first year and nobody could see them because they were so fragile.
Wow. So that's really isolating. That had its own traumatic effect on you.
Yeah. So the first year of life, the only place they went was to get RSV shots and to the doctor. And even when they went to the doctor, they kind of escorted us in a back way so we didn't have to go into the waiting room or anything. So after kind of that first year, they started, it's called First Steps here. They did therapies, and Alex, because of his vision impairment from the ROP, he doesn't have any, he can see about, I'd say maybe 8 feet in front of him, and close up he sees really well, but that side, the peripheral, is hard for him, and then maybe his eyebrows up. Right. And I think it's more cortical vision impairment, which is like a processing. Right. And then his hearing is a mild loss, more of also a processing what he's hearing. Mm-hmm. And he does well when there's not a lot going on around him, right, filtering out the sounds. And for Alex, because he has cerebral palsy and a vision impairment, that hearing impairment impacts him a little different than it would you or me, because he does have so many other challenges, and that processing time is a good 30-second delay for him. So, when you're talking to him, the hardest thing for people to remember is that he takes that slower processing time, and you have to repeat it a lot, and, give him that time that wait time is hard. Right. But, we did the first steps, and, of course he was always delayed on everything. He had a hard time eating, really did not eat anything, and we had a feeding tube placed because he was unable to eat, and did several feeding programs. Actually went up to Maryland and did a tense feeding tube program where we stayed a couple of weeks there. He does eat now, eats great now, but that was, a challenge and a process. Right. We had a really great preschool here that the kids were able to go to. It's a visually impaired preschool. It's called Visually Impaired Preschool Services. And they had like a a 3-year-old class also, or a 2-year-old class that they went to, their support for parents. And it was kind of like our godsend. We don't have any family close, so they became our family and our network, and they supported us. And actually, that is where I learned more about what my kids needed as far as their visual impairment and how it impacted them, and really learned that they're not just going to learn. You know, I that is where I learned that I'm going to have to teach them the skills that they need, because they're not going to learn by watching me. And I think that's really where it hit me, that we're not going to have a typical, I knew it was never going to be typical family, but I think that's where the whole impact of vision impairment blew me over, as far as it's so impactful having that vision loss. I didn't learn as much about even the hearing impairment until a little later, when the Deafblind Project really stepped in, and that was more in the middle school. So, but we've had some really great therapists, we have a wonderful doctor, and the Deafblind Project has been a great support for us to, come in and help Alex make progress. But I think those early years were really impactful for both of my kids to get that support and really learn to use the vision that they have. And I think being in that vision preschool environment for them really, really helped.
I'm hoping that you'll explain, if you can, how you feel like your trauma, and we could have a completely separate conversation about the trauma our children go through, right?
Yeah.
That I do think is talked about more than the trauma that parents go through. Today, we're talking about the trauma the parents go through. But I'm hoping that if you can, you'll explain, how do you think the trauma that you experienced in those early months of your children's lives has affected your parenting and your caretaking of them as they have gotten older? And in that, if you could touch on perhaps the importance of compassion from medical professionals, therapists, teachers, and anybody else that works with families that go through some of these really difficult experiences.
Well, I think it's definitely given me more patience. I think the challenge for me is that because I feared for their life, it's hard for me to sometimes push them in different areas that I need to push them in. And especially just different chores and things around the house. I tend to do things that I shouldn't do. So that, things like that are really hard for me. When they were younger, meetings were more about family. And how does this affect your family? And so that was always very comforting, right? Because you talked about how it affects your life. When they move into school age, it's very different because it's education based. And, they're not going to get as much PT or OT because it's not education based, which is always very hard to understand, of course, when you're first going in. And it's not about how can we help your family. It's more about just what's best for the school, not always what's best for the child. And when you're coming from so much trauma, and also from those meetings where it's about your family, and you're moving into that education realm, and you're still bringing with you that baggage of, I think I've told people, when I go into an IEP meeting, I still walk into the room and I'm still holding that 1 pound, 10 ounce preemie that turned blue on me and was taken from my arms, right? I never had that experience that they probably had, where the baby was placed on their chest and they got that bonding moment. The baby came out and was whisked away to the NICU unit. I never saw them. So my first moment was them in the NICU unit being told, just dot their hand or their skin will rip, like So, I go into that meeting carrying this fear of I have to be a mama bear. I have to protect them. I'm still fighting the doctor for, are they going to take them to foster care? I'm still fighting, I'm still hearing the dings. I'm still fighting for this little baby, for their life. And the first time a negative comment is said, these antennas go up, right? Of no, that's no, you're not going to do that.
And those comments can feel so crushing. And oftentimes they're made flippantly. And listen, I think people that go into like if we're specifically talking about IEP meetings, I think people that go into special education are amazing. I admire them so much and I'm so grateful for them. My daughter has had incredible special education teachers, people that go into physical therapy, occupational therapy, speech and language therapy. They're such remarkable people. I don't know what the percentage is, but I feel safe in saying that most of them have not been through what you have just described and might not understand the impact of their words. And I hope, and the truth is, I don't actually know what kind of training professionals, not just educators or therapists, but also doctors. I actually don't know what kind of training they receive in regard to, I guess some people might call it having a good bedside manner, but training and compassion. But I hope if it's not already being done, that it starts being done. And if it is already being done, that it is emphasized more in the future. I hope that people that go into professions where they work with children with disabilities or with complex medical needs and their parents and families, I hope they get trauma-informed training, that they learn that they need to approach these situations with the understanding that this population, you might find it academically interesting to specialize in a certain medical field where you're working with certain kinds of patients. Okay, that's fine. That's nice. If you find that academically interesting and that's what you want your profession to be, that's great. But please understand that you are working with traumatized people and your words matter to the ability of this population to function, to handle the trials and the burdens that they're carrying. Words matter and compassion matters. And it's just so important that the professionals that go into this field, and again, I am so grateful for them, but it is so important that they understand that it's not that compassion is nice. It would be nice if they had it. It is imperative to the emotional healing of people in this community and to the mental health of people in this community.
Well, and sadly, it only takes one time, and it seems like that is the one thing that you remember, right? And for me, a lot of times those psychological evaluations, the year that you do the 3-year evals are the hardest because they tend to be and can be very negative, right? Your child is low intelligence, is 3 grade levels behind their peers, needs extra assistance. I've heard, we bend over backwards for your child. What else do you want us to do? I mean, and I feel like as a parent, I have a right to want the best for my child. And yes, sometimes I get a little hot-headed and ask questions, but I feel like as the consumer, as my child being there and all that he's been through, I feel like I should expect that. I should expect what's written on that IEP to be done to the letter.
Absolutely. Absolutely.
And I don't want somebody to tell me I'm wrong for expecting that.
Because it is the law, I mean, FAPE is a law.
Those words that I've heard, that they don't make the accommodations, they expect the child to do them on things like emails or Google Docs or things like that. And when you have a child that has multiple disabilities, it takes extra time for them to do that. I've had conversations about, Alex carries a laptop, an iPad, a cane, a backpack, a water bottle. The time that it takes for him to sit down, get the laptop out, open the laptop, and then he has a password that's like 15 letters.
Right.
Why does he even need a password to get on? That takes him, for him to physically enter a password that has to be on top of the laptop. That's not, why do we even need it when it's taped right there? You know, like, and for him to enter that in physically and then log in and then get his water bottle out. And then, you know, it's like all these steps that nobody thought about.
Right.
Why do I have to point that out?
Right.
And
Right.
those are the things that really frustrate and irritate me because, and quite honestly, he's at a specialized school. He's
Right.
in one of the most restricted environments.
Interesting.
Like that, like I said, that lack of compassion for thinking about what these kids deal with day to day. Well, he wears his coat all day because it takes so much time for him to go put his coat away
Right.
and get it and go from class to class because he's exhausted.
Right.
And like I said, those are just the frustrations that nobody stops and thinks about.
Right. And again, this thought just keeps coming back to me. Again, I'm so grateful for people that go into these fields that work with our children, that work with this population, whether it's medical or therapeutic or educational. I'm so grateful for them. But there has to be trauma-informed training that goes along with all of the academic education, because for us, this is not academic. This is real life. This is the daily grind. This is us carrying our children's emotions as they go through these experiences. It can be so demoralizing when you carry so much already, when you have so many difficulties that you have to face every single day. And then to feel like those who are supposed to be helping you, and they are helping you in some ways, lack compassion when you are struggling. It's enough. For me personally, when I have had experiences like that, and I didn't grow up with a disability, but when I have had experiences like that in my life, for me personally, it makes me want to stop trying. It makes me withdraw. It makes me lose confidence in my ability to accomplish things. And that's me as a typical functioning human being. I can only imagine how it feels, especially for children with such complex needs. How discouraging and how demoralizing it is when the people that are there to help them, who are helping them in many ways, don't have compassion for what it is that they're experiencing, and or compassion for, you as a mother or me as a mother.
Right. And like I said, I don't want to bash them because like you said, I think you don't know what you don't know. Right.
Mm-hmm.
And I think a lot of it is that they just don't stop and think. And I think a lot of times if they said, what if this was my child? What if I was dealing with the same situation? What would I do? Because a lot of times I think I've burned so many bridges because I have fought this fight and I'm the bad guy. I keep trying to tell myself I'm not the bad guy. I want the best for him. He's got 6 months left at school and I want it to be the best that he can get. I want him to get everything out of it.
Yeah, absolutely. When I was preparing for our conversation today, doing some research about, the trauma that parents of children with disabilities go through, I found articles about another facet of this conversation, which I think we don't have time to get to today, but that is interesting. And it might be an interesting thing to speak with perhaps a special educator about in the future, that there's this idea that's been floating around education circles called compassion fatigue that applies to teachers, especially special education teachers. Mm-hmm. And as I was reading about this, I thought, I can see how when they're trying to get everything that they're trying to get done every single day, and they have all of these challenges, and they went into this field with good intentions. I feel confident in saying every person who's ever gone into special education, they go into it with good intentions and with a big heart. But there is a certain point where apparently, according to some studies, they reach compassion fatigue. And I don't have any answers for that. and it's not really even an avenue that I want to take our conversation, but it is an interesting thing that perhaps needs to be addressed, because when a teacher reaches that point of compassion fatigue where they just don't have it in them to offer compassion to certain students anymore because they are so exhausted.
Mm-hmm.
I understand, like I completely understand that. But on the flip side, as the parent of that child, we need compassion, right? And so there's some work that needs to be done in regard to both those sides of this conversation, because there are some problems that need to be solved in this space, right? I understand if they are just spent and they just don't have it in them to offer compassion. But our community, especially when we have gone through so much trauma with our children, it simply isn't something we can tolerate to not have compassion from the professionals working with our kids. It's just something to put out there for people to think about. There needs to be work done in this space. And I don't have the answers. It's just important to highlight the issue for what it is. In the few minutes that we have left, I'm hoping, Brandi, that you will, and you started moving in this direction, so I want to continue with what you were saying. Alex is about to graduate from high school. Mm-hmm. Tell us how you are feeling about this upcoming transition and what you worry the most about as Alex moves into adult life.
Well, I'm feeling very anxious and a little bit depressed because it's unknown, right? There's, no school to think about or plan for. Will he keep the jobs that he has, or will we find something else? A lot of it is doubting the decisions that I've made for him. Will he work? How much will he work? How are we going to keep him involved in the community? He'll get ready to lose our biggest resource that we have, which is the Deafblind Project. Right. They're great with him and me. And, Alex talks a lot about going to college, having a family, getting married, having children. And I'm not saying you won't, but how do you respond to that?
Because it's not as obvious of a path as it would be for somebody that didn't face these challenges.
Right. Yeah. He wants a girlfriend. He wants friends. And so how do you set him up for those successes? Right. So scary.
And my daughter is only 11, so I haven't gone through that transition yet. I already feel tremendous anxiety about it, knowing that it's inevitable. The time will come when that transition happens. But every parent I have spoken to who has been through that transition with their child with disabilities, helping them from being a child with disabilities to becoming an adult with disabilities, has expressed your exact sentiment. So much fear, so much anxiety. We think for typical functioning kids as they go into adult life that their lives aren't predictable. We don't know how things will work out for them. For children with disabilities, we really don't know. There's no way to really predict. All we can do is look to the resources that are available. If we don't find what we need, then we have to, once again, engage in that important advocacy to try to get them the resources they need. Sometimes we're able to find them or create them. Sometimes parents spend the rest of their lives advocating for services that their adult children with disabilities don't ever get. And the work that they do in that advocacy space never benefits their own child, but it does benefit children that come after. There really is no way to describe the anxiety that parents feel as their children transition into adulthood when they face the kinds of challenges that Alex faces or that my daughter Isabel faces. And again, people that live their lives outside of this space, it helps us inside the disability community, for people outside the disability community to understand, to offer compassion, to offer empathy, and to just say, I don't know what it's like, but I'm happy to listen. I'm happy to help in whatever way I can. That empathy, it just goes so far in helping. Like, somebody offering me empathy in my difficulties, it doesn't fix my problems, but it sure helps them to feel less heavy,
Mhm.
So in conclusion, Brandi, how do you and your family need the world to change?
Um, so I've thought about this a lot. This is a tough question. But all I could really come up with is just that for people to kind of realize and know that these cute little kids grow up to be adults,
Yeah.
and they, feel awkward, and they need resources, and those resources are not readily available for them, and gets harder and harder for people to understand what these kids need, because people tend to want to help when they're younger.
Yeah.
And people tend to want to understand, but when they get older, people tend to, I guess, ignore or not be as, I don't know,
Yeah.
it just seems like there's more resources out there. So I wish there were some more programs that were easier to access, and that, schools started earlier,
Mhm.
um, preparing families and kids for the future and helping access what's out there.
Right. Something that you said to me the other day really stuck with me. You said at a certain point they stop being cute.
Mhm,
And when that happens, oftentimes the way they're treated is different because
mhm,
they go into puberty. They start becoming awkward, just like other teenagers, and they grow into adult life. And the cuteness that may have delighted people outside of the disability community prior is gone, and they grow into adults, like real adults, just like anybody else, real adults who have different challenges than most adults have. And they still need that love and attention, and they still need the support and the community. And the parents still need the support in the community, even though maybe they don't offer that same, delight that they once did when they were these cute, little kids that, yeah, they had disabilities, but look how cute he is. Look how cute she is,
yeah,
I mean, that, yes, it's delightful, but that's not why they're here. They're not here to just be cute for people. They're real human beings who have real problems and real feelings and real challenges. And people inside of this space, we need compassion at large
yeah.
from people outside of this community.
Mhm. Look at their little cane, or look at their little glasses. They're so cute. And, all that kind of goes away once they get
Yeah.
older. And so I think just realizing that parents still need support
Yeah.
as they get older, because really that reality kind of does sit in, and it becomes overwhelming.
Yeah.
So that's all.
Brandi, I cannot tell you how much I have appreciated this conversation, and I hope to have more like it. I've spoken so much with people who have come on Warrior Stories about policy advocacy, which again is so, so, so important. But this space that we have been in today, where we've been talking about things that are felt, not things that you see, but things that are felt, I just think it's so important. And I hope the more we talk about what it feels like to go through these challenges, the trauma that every family that has a child with complex medical needs or significant disabilities goes through, I hope there can be more compassion in the world toward, not only our children, obviously they need it, but also us. You know, it's hard. And unless you've been through it, you just don't know how hard it is. And that's the bottom line. And we could use some compassion from the world at large. So
Thank you so much. This has been great for me. I think I needed it. So,
good. Well, thank you so much, Brandi. And we will definitely keep in touch. I know
okay.
NFADB, we're busy preparing for, some big advocacy coming up. And so of course we'll be connected in that way. And I look forward to seeing you in the future.
Okay. Thank you so much.
Thank you, Brandi.
All right.
Okay,
Bye.
bye-bye.